Carpal tunnel syndrome is due to compression, as seen on this diagram, of the median nerve as it runs through this area of the wrist called the carpal tunnel, and it is predominantly due to this ligament called the transverse carpal ligament. And you can see on these diagrams, there's the median nerve, there's tendons all around it, and then this ligament that goes from bone to bone. These are carpal bones or hand bones, and this ligament's called the transverse carpal ligament. And in carpal tunnel syndrome, that nerve becomes compressed due to thickening of that ligament. And the treatment, as you've seen, is if it fails conservative care, is to sharply divide that ligament, usually up to the forearm, about a third of the way up. And I do that all through a minimally invasive incision and approach that you've seen with using a scope type instrument to divide that ligament up to approximately the mid forearm area, because the ligament extends that distance. Another common peripheral nerve disorder that we treat at Legacy Spine Neurological Specialist is ulnar nerve entrapment at the elbow. Now, typically that occurs in the area of the funny bone. And as the ulnar nerve passes through here, it can become entrapped. Again, through a similar situation like the transverse carpal ligament and the median nerve. Unlike carpal tunnel, which causes numbness, tingling, and pain in the hand and various degrees of weakness, ulnar neuropathy is almost never associated with any pain. Now, it can have some pain about in the elbow area and occasionally into these fingers. Usually it's just either tingling, numbness in the ulnar, these two fingers, or the patient's had progressive weakness of the hand, or both. And if it gets really bad, one can end up with a deformity where these two fingers, because of the weakness in the ulnar extension, become clawed up in this manner like this. And the numbness with carpal tunnel syndrome is typically either you feel it in all the fingers or mainly in the thumb and the first couple of fingers. So it's a different pattern of numbness and weakness. But these two disorders are very commonly treated or commonly encountered. These two disorders are commonly encountered peripheral nerve entrapment problems that we deal with at Legacy Spine Neurological Specialists.